So let's start. The question number 4. The question is, pus protruding through the fibril end of the fallopian tube is sure sign of genital TB. The statement 2 is HCH. HCG is contraindicated in genital TB. So in the light of the above statement, choose the most appropriate answer from the option given below. Okay. So let's see what is the correct answer. See, uh, let's first make it out a short note of the genital tuberculosis. Okay, then we will give the answer. So let's start the genital tuberculosis, a short note. And what are the questions can be asked from the genital tuberculosis? So genital tuberculosis, the commonest organism is Mycobacterium tuberculosis. Okay, so this is can be one of the questions in the MCQs. Remember, genital tuberculosis is not a primary, it is always a secondary to the primary tuberculosis. The primary is always in the lungs, so it is secondary to primary tuberculosis. Now, what is the most common site? The most common site for the genital tuberculosis is fallopian tube. This is another question they can ask, the fallopian tube. The 90 to 100% of the cases, the fallopian tube. Other are the endometrium, ovaries, cervix, and the vagina. They are the rare. Now, if they ask you what is the spread of the infection, so the spread, this is another question they can ask. Now, how it can spread? Number most important, the mode of spread is via the blood. Okay, so hematogenous route. So this can be one of the MCQ, or in the lymphatic, the most common is the hematogenous. Okay, the other one is lymphatic, and also the direct spread from the edge, from adjacent organ. Always, so if there is some blockage, now suppose if there is some blockage, okay, to any type of the infections, okay, the most common clinical feature will be infertility. Okay, the most common clinical feature will be infertility. There must be some chronic pelvic pain. Along with this, the patient might complain of menses irregularity or the menstruation irregularities and the vaginal discharges. So these are not that much common. The most common symptoms the patient will come to you with the infertility. Okay, if there is some tubal blockage. Now, how will you detect the case? The detection is through the laparoscopy, and from the laparoscopy, what we see that a pus or a cheesy material protruding through the fibril end. Okay, so from the laparoscopy, we can find this. There is some pus or cheesy material protruding through the fibril end. Protruding through fimbrial, okay, through this end, okay, through the fimbrial end, okay. So obviously this is the most diagnostic point. So if you see the question, pus protruding through the fimbrial end of the fallopian tube is a sure sign of genital TB. Yes, statement 1 is correct, okay. And HSG is always contraindicated. Why? Just wanted to remove this. Yes. So remember here HSG, that is hysterosalpinography, is contraindicated. It is never done. Because why? If there is some latent TB, it get reactive. Okay, so there is an activation of the latent TB, and that worsen the pelvic inflammatory diseases. Or sometimes the hysterosalpinography may cause ascending infection. So if there is an tuberculosis of the fallopian tube, it causes an ascending infection, and the infection may spread to the peritoneum. Okay. Other thing is that the tube is very fragile. So if HSG is done, then it can resulting in the rupture. So tube are fragile due to the granulomatous infections, and which resulting into the rupture. Okay. So visiting granulomatous inflammation of the fallopian tube on the laparoscopy, it looks like a tobacco pouch appearance. Okay. So there is another question they can ask, where we can see the tobacco pouch appearance. Okay. The tobacco pouch appearance, it is seen in the laparoscopy of a genital tuberculosis. HCG is not allowed. It is allowed only after anti-tubercular therapy. Sometimes they can ask, what is the radiological finding? Okay, what are the radiological finding, or what are the findings of in case of hysterosalpingiography? We will see that is tobacco pouch appearance. It is seen in both in this laparoscopy also, and also in this HSG, and also a beaded tube. Okay, so beaded appearance of the tube. Beaded appearance of the tube we will find in the hysterosalpingiography. Okay, so got it. Now suppose, now I think you can tell the answer. HCG is contraindicated in genital TB. Yes, it is contraindicated. Why? Because the tube is either fragile, resulting into the infection, or infection can spread to the peritoneum. Okay, or if there is some latent TB, there is an active, the TB is get active. Okay, and worsen the pelvic inflammatory disease. So here both the statement 1 and the statement 2 are correct. Okay, remember this. And also, what are the other questions? They can ask you about the tobacco pouch. They can ask you about the beaded tube appearance is seen in which disease. It is seen in the genital tuberculosis. Or they can ask you what is the most common spread of the genital tuberculosis from the primary focus, that is the hematogenous route. Okay, and what are the most common clinical features the patient comes to in your clinic? The answer will be infertility. And what is the most common site for the genital tuberculosis? The answer will be fallopian tube. Okay, so these are some of the questions that can be asked only from the one topic. So let's move into the another part.